guys, Heather here, and this video request comes from Gabriella, and she was wondering how to do injections. Hi Gabriella. So how many of you are like super excited about giving injections to patients? Or maybe you feel like throwing up or passing out at the thought of a needle, right? I know I did. And I was afraid as a nursing student. I was like afraid I was gonna hit a liver or spleen or a bone or something. And one time I had to give an injection, a muscular injection into this, little frail lady who was like, had no tissue. She was like a skeleton with a layer of skin. And so I tried to pinch like as much as I could here. And so I inject my needle and I hit something. And I was like, oh my God. And I look at the lady and she's like, she didn't scream, she didn't punch me, she didn't curse at me. So I guess hitting a bone isn't really the end of the world after all. But today I have Mr. Peach. This is my patient, Mr. Peach, and yes, he does have a barcode, right? Because patients have barcodes on their armband. So this is Mr. Peach, and I'm going to show you how to give a sub-Q injection here. In nursing school, they always tell us to practice on an orange at home, right? But I have like this tiny insulin needle, and if I tried to put this in an orange, it would probably like bend and then it wouldn't work anymore. So I'm using a peach. When giving a sub-Q injection, it's usually given like in the abdomen where there's like a lot of fatty tissue, or like behind the arm here. So you want to hold like some tissue in between your index and thumb, and you inject your needle like a 45-degree angle. And that's what they teach us in nursing school, or that's what I learned in nursing school, but I'm not sure they teach that anymore. So can someone let me know if they still do that? And then you just inject your medication, and then you have your safety clamp here, which you want to push up when you're done so you don't stick yourself, but I'm not going to do that right now, so hopefully I won't stick myself. And then there's an injection called the Z-Track. And I don't even think I've really given this on a real patient, but you're supposed to like kind of move the subcutaneous tissue over like an inch and a half to kind of get out of the way so you can inject it into the muscle. And the purpose of that is because some of the meds like iron and visceral can be rather irritating to the tissues, so we just kind of want to get that out of the way. So when giving a muscular injection, you want to insert your needle here, and then you want to pull back on the syringe over here, and if you see any blood in the syringe here, then you probably hit a blood vessel and you're going to have to throw away your needle and your medication and start all over. And that can be kind of embarrassing, but you got to do what you got to do, right? For a quick up-close demonstration, you're going to insert your needle into the muscle and you're going to draw back. See where you see this chamber here? If you see any blood filling up here, then you probably hit a blood vessel. Well guys, thanks for watching. Have a great day and I'll talk to you soon, okay? Bye!